Hey there, Mike Estramante here. I'm the CEO of StarMed Healthcare. If you're watching this video, it means that you just made an appointment to have a virtual appointment to get your test done. Before I go into anything else, I just want to make sure you know this full and clear. That's an appointment for your virtual visit. You must complete that before you get in line here to get your test actually performed. So once again, thanks for choosing us for your testing needs. A few things I wanted to go over with you. The first thing is a lot of people have a little bit of apprehension or even fear about getting the nasal swab test done. Rather than kind of telling you, I'm just going to read a review from a patient here. The process of getting the test was much easier than I anticipated. The idea of putting a long Q-tip thing up my nose far enough to touch my brain made me want to cry just thinking about it. But the man who reassured me earlier, it is a thin, flexible testing wand, not a big Q-tip. They just swizzle it around a bit, and by the time they move from one nostril to the next, you'll be amazed how fast it is over. And he was so right. It did tickle and brought tears to my eyes, but it wasn't painful. And it really was small, and I didn't feel like they were trying to probe my brain at all. It really was over in no time. And in fact, when they thanked me for being tested and told me that I received a text message with the results in a few days, I could hardly believe it was all done. So like I said, that was directly from a patient. And I've had it done a few times myself. And I'll tell you, it does tickle and makes your eyes water, but it's not that horrible. So a few things. Once you get in line, once you arrive for the test, you're gonna have somebody come up and greet you, and they'll ask you. They'll stay 6 feet away, and they're gonna ask you for your insurance information, your photo identification. If you don't have a photo ID or insurance card, that's okay. They're going to write down some information. For those of you that don't have insurance, we bill all this through the CARES Act. It's covered at 100%, as well as the carriers. As of right now, none of the carriers are requiring cost sharing. So we do have a few available options that are additional. There's a fee, unlike the nasal swab test, which is at no charge. We have an antibody test. An antibody test is different than what they call the molecular nasal swab test that actually tests for the virus. An antibody test is going to tell you and us if you have antibodies in your blood that have reacted to COVID infection already. So it can be indicative of past exposure. Of the thousands and thousands of people that we tested, roughly 6.1% of everybody actually has the antibodies in their system already that should show that they had a prior infection. So like I said, that's optional. There is a $50 fee for that because it's not covered by insurance, but we want to make sure that if that's something you're interested in, it's available. The other thing that we offer is vitamin D injections. As early as April, out of Italy, they started finding that people that had more severe outcomes associated with a COVID-19 infection were also had low levels of vitamin D in their blood. And since then, they've been doing a lot more research on it, and they have found a correlation between low vitamin D levels and more serious respiratory problems, amongst other issues with vitamin D deficiency. So what we decided to do a few weeks ago is put up a special tent on the other side of this tent that's specifically meant for vitamin D injections. Easy procedure. It goes right into it's an intramuscular injection into the shoulder. Takes a few seconds. There is a fee involved of $45. But unless you're taking a vitamin D supplement on a regular basis, it's something you definitely want to research. And our website, starmed.care/D. That's starmed.care/D. We'll give you additional information on the research and a nice video about vitamin D injections. A few other things here. Results. So typically speaking, our clinic is able to accomplish results in 1 to 2 days on average. However, that's 90 to 95% of test recipients. 5 to 10% of these tests need to be rerun by the lab, and it's for various reasons. If you have to have your test rerun, it doesn't mean that you were positive. As a matter of fact, most of the tests that are being rerun come back as negative. It's not exclusive to our lab. That's across the entire country, across the world, that with PCR nasal swab testing, 5 to 10% of the time, the test has to be rerun, and then it extends the time. Right now, the tests that are being rerun, it's taking 3 to 4 days total to get those results back. So it's unfortunate when that happens to be you, and I know it's frustrating. I do want to mention that The best way to get our results right now are two ways. We email you the results and we text you the results. We've had to go to a digital form of communication for both. The emailed results will send you to our portal, whereby our portal, you'll create an account and you can actually go there if you need to print out something for your employer with your results. That's the best way to do that. As a fail-safe to make sure we're not missing anybody, we also text message you your results, negative or positive. And if you are positive, we give you a link to a page that will explain to you, home care, self-care, things you can do to make sure, just simple things like make sure you're drinking plenty of fluids and getting rest and making sure you're eating well during this time period. But also the warning signs for more serious signs of infection that might require you to call 911 or have to visit the emergency department. We do ask, our clinic normally would field around 300 or 400 calls a week. We have 800 incoming phone calls per day into the office. And just like every call center, I don't know if you've experienced this across our country right now, our clinic can only handle a certain amount of phone calls. So we found digital communication with emails allows us to respond far quicker. So wanted to make sure you were aware of that. So, and last, we value your feedback. StarMed's been around for a couple of years now. We have 2 locations in Charlotte. We're actually in the process of opening a 3rd and a 4th. Right now we're on Freedom Drive in Tuckasegee, and we have a practice out in the east side of town off of Central Avenue, Albemarle. We're always looking to improve. We're here for the community. This was began. Dr. Piramzadeh is actually in the clinic right now seeing patients. Excellent physician. We have some best providers you can see in Charlotte. We're so very proud of all of them. And essentially, we welcome reviews. And if there's any areas where we can get more positive feedback, it helps motivate the staff to do better. And if there's anything that we could have done better, we prefer you to give us an email and let us know. The error is human. We prefer not to have any mistakes, but if we do, we want to make sure we correct them. But like I said, everybody back here is working so hard, 90-degree heat most of the time this summer, and they love those positive feedbacks, whether you go on Google reviews or whether you go on Facebook. Loud motorcycle, sorry. We welcome that. So once again, thank you for choosing StarMed Healthcare for your testing needs. Hope you have a wonderful day and stay healthy.